Organizations continue to reach out to Angelenos, especially in the low-income citizens, as the implementation of Obamacare is approaching. Mona Adem has more on this story.
With less than 4 months until the new healthcare begins for millions of Californians, Service Employees International, United Healthcare Workers for America, continues their mission to make people ready for Obamacare. Volunteers and staff members welcome potential healthcare participants before describing the Obamacare and Let's Get Healthy California mission. By targeting low-income neighborhoods of South and East Los Angeles, the union tries to raise awareness about the changes that will occur under the new health reform. Elliot Perry, the lead organizer who has been with the union for over 2 years, said one of the biggest obstacles to overcome is the feeling of hopelessness.
You know, these are really working class neighborhoods, working class communities, and so the biggest obstacle really is people's hope. Or lack thereof. You know, we are dealing with folks who have encountered all sorts of obstacles to getting health care coverage. They've been told no and don't know why. They've been given the runaround, been told to go here and go there, and they can't find any help. Some people have had coverage and then were dropped from coverage and have no idea why. The system doesn't speak to people in a way that's plain, in a way that's simple. And so it creates a lot of confusion, and people begin to lose, little by little, begin to lose their hope.
But while California, which has one of the highest rate of uninsured residents in the nation, may be in lead of implementing Obamacare, a new poll shows that 60% of Californians are somewhat knowledgeable about Obamacare.
Well, I just know that it gives health insurance to people. And to people that already have insurance, it just keeps it the same way.
I believe when you're 18, they take it away, right? The Medicare, and so you have to get your own health insurance.
If you're not a full-time employee and you don't have health care, that they're going to take it out of your tax refund or something like that. I'm not sure.
Well, first of all, I don't know what Obamacare is, so if I knew, then I would have, but Obama, please help me.
Rudy Becerra, an organizer for the union, says the main reason why low-income residents have a limited knowledge of the new healthcare reform is because there are too many outlets that give wrong information.
There's a lot of confusion, too, with the programs. So what we do is really try to create understanding and help out with the Medi-Cal. This is what Healthy Way LA is. This is what Medi-Cal. These are under Obamacare. Obamacare is not a plan, it's the law, and this is what's under Obamacare. So really, that's very true. A lot of the folks that really need it don't have the least amount of understanding, and so that's our job, is going out there in the community, and that's why we're in certain communities, South Los Angeles, Boyle Heights, Compton, Linwood, because those are, low-income minority communities that really need to know the information and really need the benefits the most.
Not only do Californians learn about healthcare reform, they also get informed about the different clinics available to them to get the help they need. AltaMed is one of such clinics that help specifically low-income patients. Alfonso Vega, director for AltaMed, says healthcare should not be a commodity, but a basic human right.
So from our perspective, healthcare reform is a dream come true. Within our communities that we serve alone, there's over 500,000 people who currently are uninsured that will have access to healthcare that have never had access before. Within our own clinics, there's 65,000 people that currently have either no insurance or some type of partial coverage that will qualify for full coverage effective January 1st. So the opportunity is tremendous. It's absolutely tremendous.
After visiting the different stations and gaining a little bit more knowledge about Obamacare, many potential participants felt that the day was not only helpful, but also provided a relief.
Now I can say that I can help my brothers and sisters, my neighbors, and not to be afraid.
Well, I feel that I know more, that I can go home and tell my mom and dad, about it because they don't know.
I haven't been to a doctor in nearly 10 years,
Angelito de Guzman. Angelito de Guzman.
I'm pretty happy now.
In East Los Angeles, I'm Mona Adem, Valley View News.